After 38 years of practicing chiropractic, I was tired of tables breaking. I was tired of watching high-lows go up and down. I was tired of waiting for people to come and repair them. I decided that I needed something that was functional, safe, and dependable. I wanted to wake up in the morning, drive to work knowing that that was not going to be the day that something broke, that something failed in the middle of being used. I didn't want to hear people in the rooms putting the tables up and down. I didn't want to hear knee chests being played with. So I decided I would make something that was solid, something that wasn't made from wood, something that had no screws, no bolts, no hinges, no wires, no motors. We actually had a day when we had no electricity, and I worked the entire shift. Didn't lose a minute because we had these stable, metal, welded together pieces of equipment. The kneeler is made of 1.5-inch steel, 1/8-inch wall steel, all welded together. You could park a car on this thing. There are two ends, two heights. I thought when I made this, I'd put my taller people on this side, I'd put my shorter people on this side. Well, I learned a lot in the first couple days of using it. I have a 5-foot-tall woman who uses this end. I have a 6'6" guy that uses the short end. So every patient will get accustomed. You'll learn what fits each patient. Tremendous flexibility. As I designed this piece of equipment, I started with 6 different heights. And I found out I needed just 2. So then we became the 2-ended kneeler. The padding is separated just enough. Any height person can look straight down. Their nose fits in, their chin fits in, they can breathe, they're stable. There's even a depression enough that the spine has a little give. So we have support holding the body, and the spine has plenty of room to move. On the pelvic bench, there's no rock, there's no skinny little legs holding it up. And most importantly, the fabric that we're using is a non-slip vinyl. The non-slip vinyl is great because we can wipe it off. We can keep it clean. We don't have it absorbing any scents. Somebody will come in, they might be a smoker. They might be a person who was working all day. They're going to have a certain amount of scent on their clothing. This material holds no scent at all. Yet, it doesn't allow the person to slip. That was the major argument against vinyl all these years in building equipment was, oh, you have to use fabric because the patient will slip on vinyl. The newer vinyl does not slip. Easy to wipe down, easy to move the patient, easy to secure the patient. Pelvic bench, kneeler, chair, all come, and this exam stool, all come in design heights just for you. If you decide you want it 25 inches off the ground, you can have it. Heights are custom. The rest is all stable and normal. Cervical chair at the perfect angle. Dr. Gonstead worked his whole life to decide what angle the chair should be set at. I was actually at the seminar where he announced that he decided the upright position on the cervical chair. Yet people still use cervical chairs that break away. This is the right height, this is the right angle, and it's stable. Nothing's going to fly away, nothing's going to move. The depth of the back of the chair is made so you can get in close to the patient. You're not 4 inches away. The chair is open in the back and the side so you can put your feet in there. So no matter where you're adjusting, you can get it. We have 5 different foams. We have a foam for the seats, 2 seats. We have a foam for the back. We have a different foam for the kneelers. We have a different foam for the pelvic bench. so you don't have too much give. And we have a different foam even for the pads for the spinal adjustment, so you have enough give but enough protection. The height of the design of the stool is for motion palpation. The doctor can sit on the cervical chair, use a nervoscope or whatever instrumentation he wants, and not kneeling down trying to look at his instrument. Motion palpation. The exam stool's set up higher, so you don't have to bend over to motion palpate. Patients brought up, you can move their head, you can flex, extend. Everything's easily seen as you use the exam stool. No screws, no bolts, no hinges, no wires, no motors, nothing to break. You can pass this stuff down to your son or daughter when he or she becomes a chiropractor. Think of it. Nothing can break. Do you ever hear a noise when you're in the hallway doing a little paperwork? Your high-low going up and down? Not me. Did you ever hear the knee chest collapse? I'm wondering who's getting hurt? Not me. Ever be using your cervical chair and move a bone and you see some screws fly across the room? Not me. Ever have someone on the cervical chair and the back breaks away because they move forward? Not me. This is not good.
All right, we have the main focus is high-low. Odors.
You ever show up to your office and your receptionist say, I was setting up the rooms and the high-low won't go up? Not me. Are you tired of watching your high-lows go up and down all day long? Not me. Do you worry when you leave the room that someone's going to play with the equipment? Not me. Do you worry about the knee chest breaking away as you thrust down on a patient? Not me. Do you worry about the chair or the back of the cervical chair breaking away as you move a person from one piece of equipment to the other? Not me. Do you worry about the electricity going out and not being able to work? Not me. Do you worry about, is your equipment going to work? Is the guy going to show up to fix it? Is he going to have the parts? Not me. Have you ever sent your high-low away and spent $3,000 and it came back worse than when you sent it? Not me. This equipment is made to last. This equipment is made to do the job day in, day out. Nothing to move, nothing to break. Pads are easily changed within a few moments. You can decide to change the color of your equipment. You can get new pads. We'll send them to you. You'll take these pads off. There's no screws. There's no bolts. There's no hinges. The pads come off. You put them right back on. It takes moments to change. The vinyl you can wipe down. It doesn't hold any scents. The Forever series of chiropractic equipment has a few features that are... Can I start over again?
Okay. Take two.
The Forever series...
Wait. When I say take two, you're going to give it 5 seconds.
Billy Mays. 5 seconds.
Every time you say something, you gotta wait 5 more seconds.
The Forever series of chiropractic equipment was designed with one important feature in mind. The pads can be changed in seconds. They're able to be ordered separate, one pad, or all the pads, in any color you want. They come off, they change in seconds. You're not down, you can do it between hours in the middle of the day, you can do it at lunchtime. You can do it between patients. You can replace one pad, all the pads, some of the pads. They come off, your frame stays exactly where it is. You don't have to send away. You don't have to have anybody come in to do it. You don't lose any days, weeks, months. And you keep your equipment for your lifetime. The frame is indestructible. The pads are interchangeable.